The aim of the review is to make people's health better and to give them better health care. It's quite simple. I think the NHS has, for the past few years, concentrated on improving access to services, waiting times and so forth, but it's a great opportunity now to actually improve the quality of care. To change that, really, you have to hear two voices, I think, and that's the voices of patients and the voices of the people that really look after them on the front line. We've put together 8 groups of professionals. It's not just doctors, it's not just nurses, it's actually not just the health service, it's people that really make a difference to people's health. So that's patient representatives, voluntary groups, hospitals, general practices, primary care, and our partners in social care, local authorities and in education, because I think the public recognise that all these people have a part to play in our health. We've got, within the groups, it's quite a structured process. We've got a timetable, we've got meetings planned, we've been given data, and somehow we've got to collect that information together. But I think a really powerful way of finding out about people's experience is stories. So I think one of the best ways of getting that information from people is for them to tell us their story about their health and their healthcare. I think it would be really important for the groups that I'm chairing to really get that information. One of the things we really need to be able to do is to find evidence, people's experiences where they say, this was great, I got great healthcare, I'm much healthier for it. How did that happen? Who did it? What did they do? Because if I know that, we can actually use it and make sure everybody gets it. I've sensed some fantastic enthusiasm for this process. I think all the people I've been engaged with in the health sector and who are on the groups, and those outside as well from social care and education and the voluntary sector, are really keen to get involved and get their voices heard, because I think everybody thinks this is a real opportunity to make a difference. So I think there's a huge number of people out there delivering fantastic care, great talent, and it's just harnessing all of that. The big concern for me is people's access to healthcare. We know that in some places at some times we can give absolutely brilliant care to people in the National Health Service, and that's across the whole North West, but not to everybody and not all of the time. And the key thing is to make sure the very best that we do is delivered to those places where people can't get access to healthcare. We know, for example, in inner cities that people have less GPs per head of population, and yet they have the poorest health. We know that in certain bits of Manchester that men live for 20 years less than they do in Kensington and Chelsea in London. And that is something I find very difficult to understand. So it's really, for me, very much about what do I and my colleagues need to do to make sure that we make a difference there, that we can stand here in 10 years' time and actually we've made a big difference to that. I'd like to hear from all the people that work in the National Health Service, the patients and the public. What are we not doing so well? Where are the areas where you think you've maybe felt let down? Where are the areas where you think they're doing a brilliant job there? Why doesn't everybody do it that way? At my hospital, and I think pretty well every place where we look after people in this way, things happen sometimes that shouldn't, and sometimes the care is not as good as it should be. And we must make sure that we learn from that, because then you can make healthcare safer and you can make it higher quality and you can make everybody feel that they're being treated with respect.